is a LiveWell talk on back pain. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Joining me today in the studio to discuss back pain, which is a common ailment that impacts just about everyone at some point in their life, some people more severe than others, is Carol Schueller, who is St. Luke's Therapy Plus Manager. Hi, Carol.
Hi.
What is Therapy Plus? I think, for the longest time, I thought it was something different than physical therapy. I write an order for physical therapy, then I'd hear Therapy Plus, and it took me, it was a while, that's okay, that's the same thing. So why don't you tell us what it is?
Sure. Therapy Plus is the name of our outpatient orthopedic clinics. We primarily deal with outpatient orthopedics at the 4 locations. And it was a name that was suggested 25 years ago, and one of our therapists suggested as a name to associate with the different clinics. And since then, it's stuck, and that has followed us as we've built our Therapy Plus clinics at the various locations.
And how many clinics do we do?
We have 4 currently. Our original one was downtown above Workwell Clinic in the 830 building. And then currently we are in Hiawatha, Marion, and at Westdale as well.
And has the COVID probably slowed it down a little bit, perhaps, but you back up to pre-COVID?
It did slow down just a little bit, but now we are reactivating. We're allowing extra time for cleaning between patients, and all our patients are wearing face masks as our therapists, and they're wearing face shields. But we are definitely reactivating and keeping very busy.
So what therapies do you provide there? I mean, physical therapy, obviously, yeah. But give me kind of the spectrum of, or continuum of care that's delivered.
Sure. So physical therapy is the primary thing that we have available at the 4 clinics, and we will treat patients with injuries or after surgeries. And we also have occupational therapy that's available at our downtown clinic, and that specializes in work rehabilitation and does hand therapy as well as upper extremity rehabilitation.
Okay. But it's not always, I know from like my background in sports medicine and being a team doctor for various football teams, that, I send people to therapy and for that. But so I guess the take of, you don't need to have surgery, an orthopedic surgery, to have therapy. Sometimes you need it just for routine, common injuries, correct?
Right, yes. We'll see patients that will have injuries from just something at home, or maybe it's from overuse if they're starting to have some aches and pains. Back pain is the number one thing that we see patients for, but also shoulders, knees, could be a variety of things that we will treat.
And I think over the years, there's been different studies, as we're going to ask you about back pain, that in combination with therapy, surgery can be avoided sometimes, correct?
Absolutely.
Yeah. So tell us about back pain. I mean, what you see, how it presents.
So a lot of times we will see patients with back pain. Most of the cases that we see are non-surgical patients that have just had pain from an activity or just had ongoing back pain. We'll treat that with an evaluation, the first visit. We'll spend about an hour with the patient talking to them about what causes their pain, what makes it worse, what things that they've tried to make it feel better. We'll assess their range of motion strength and do some special tests to try and zero in on where the pain's coming from. And we have a variety of treatments that we will provide. Sometimes it's almost all of our patients have exercise to get stronger, or for some stretching, and then sometimes we'll utilize some different modalities to help with pain relief.
I did a little inside baseball here. I worked with you to get dry needling as a service, which is taking off. I know it's busy. I think one time we had 2 therapists. I don't know how many there is now.
Right now we have 3 therapists that are certified, and the 4th is very close to certification. It's been very popular. And in regards to back pain, it will help if someone has a muscle knot or an area of tightness, and the dry needles will be inserted into that tissue to try and help to loosen that up. Been very successful. Patients have done very well with that, included in their therapy treatment. It's different than acupuncture. Acupuncture the needles will go in and stay in that location, where dry needling, it goes in to try and elicit a muscle response to help with the pain relief.
Yeah, I kind of describe to people as it's like hitting your computer freezes up, you hit Control-Alt-Delete, and it unlocks. That's kind of what you just poke it in there, which is interesting from that standpoint. In back pain, how long is the average? I know it's probably hard to answer because it depends on what they're presenting with. But what is the length of how many times does someone have to go to therapy?
Right now, our average is around 7 visits. We do what's called Care Connections outcomes, and the patient will fill out a survey before they start therapy and at discharge. And it shows that their pain improves and their function improves in an average of 7 visits. So around 7 right now, but it varies based on the patient's injury. Some will be less, some might be more.
And then, we document in Epic, because I get the reports of my patients that go, which is always nice. And you don't always, little pitch here for the company, but you don't always get that when they go to outside physical therapy.
It allows that continuum of care where the
absolutely.
provider can read the notes.
Well, you can read it and you can say, whoa, that's going good, or this isn't going as well as I thought. I better call them up.
Absolutely.
But back to back pain, what are some warning signs that a patient may say this, or the therapist may say, we need to have you talk to Dr. Arnold, or whoever their physician is?
Sure. So we'll look at increasing pain, which would be a concern. Any sudden weakness in the leg would be a concern. Any bowel or bladder issues, those would be the signs that we would look at as far as making sure we get back to the referring physician.
And if the numbness and tingling goes down the leg.
Absolutely.
Right? Yeah, that's what you meant by the weakness.
Mm-hmm.
Carol, one of the kind of the urban myths or legends or fallacies is that back pain, if you have back pain, you need bed rest. Tell us about that.
Right now, a lot of the literature is showing that patients are better off by staying active, just even walking around and trying to keep up with daily activities as much as they can. And we will encourage that as we do the therapy, as have patients try and maintain a normal lifestyle as much as they can.
We always used to say in the hospital, you say most patients die in the bed, so get your patient out of the bed.
Keep them moving.
Keep them moving,
Yes.
Absolutely. So you got an anniversary coming up for physical therapy or Therapy
We do.
Plus.
Therapy Plus will have their 25th anniversary coming up that we're going to celebrate in the month of September. It was delayed a little bit due to COVID. And
so you started there when you were 6.
I know. And we have 4 people on the core staff, 4 of our therapists and 1 assistant that was with us from the very beginning 25 years ago. So we're pretty proud of that. We've really grown over the years and feel that being co-located in the buildings with the physician offices has really helped us with our growth. We're more convenient for patients where they live and work to come to therapy.
Yeah, it's a great resource.
Mm-hmm.
Just an outstanding resource. How does someone get a referral to Therapy Plus?
To therapy, yes. They can talk to their physician or provider and get a referral. If it's an Epic provider, then they can send that through Epic, which works out really well for communication. We will also check with patients' insurance and we'll be very transparent with them on their financial responsibilities before we'll see them. So that's been a very positive aspect of our care as well.
All right. Well, awesome, Carol. This is great information. Thank you for coming by. Once again, that was Carol Schueller, manager of Therapy Plus at St. Luke's Hospital. For more information, visit unipoint.org.
Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.